Hey, everybody. Hi.
Hi,
Hello.
Hey,
here I am.
How are folks doing?
Hanging in
Hey,
there.
I just went and fished one of my lawn chairs out of the river, so I'm feeling kind of frosty right now.
What? Why was
We
your
must have-
launch here in the river?
why was your chair in the river?
We must have had some high winds or something. There were two chairs that went over the bank.
Oh,
One,
Oh, no kidding.
one of them was in the river, so I went and rescued it.
Nancy, you do know that dumping stuff in the river is highly illegal.
Yeah,
Tell that to my
really.
neighbor. Tell that to my neighbor.
Touche. Yeah.
Hey, Ashleen, if you can, would you take minutes? But if you can't, Erin said she could transcribe them from the recording.
Yes, I can. Let me open up previous minutes.
Okay.
Or did you send an agenda?
I can put the link. I might not have this time. I think I only sent one email instead of the two. I'm putting it in the chat for you.
Great. Okay. Thank you.
Thank you.
Totally unrelated to this meeting, but Ayla, my son Ben, sends his greetings.
Sorry, you caught me mid-biting my salad, but that's wonderful. Please send him my love. It's nice to hear from him.
I'll do that.
Let's give it another minute. I know there's a few people who can't make it today.
Ted, this is unrelated too, but did you get my email about the grant application?
I think I did. I have been flooded with so many emails. I'm trying to keep everything straight in my brain. But yes, I think I do remember seeing that.
Yeah.
You need some action from me?
Nope, we're all set.
Okay, it's just an FYI.
We will. We will.
Okay.
Yeah.
Okay, well, let's get started. Any additions to the agenda? One that I'm getting in the chat is just a question about setting, maybe changing up the scheduling of this meeting to be like first and third or second and fourth rather than every other for those like 5-week months and stuff like that, which totally, so we'll just save it to the end, but I think that's a great idea to bring up. Gary's on. Emergency management, Gary?
Not much new, except obviously the numbers of affected people are increasing dramatically. So we got to be even more careful than we have been. You know, we're not even supposed to cross the Connecticut River, which is kind of painful for those of us who live here. But I think we just need to emphasize taking it easy, wearing the mask, social distancing. As Dr. Levine said, one big concern is gatherings at Thanksgiving. So just keep doing what we're doing and not letting our guard down or you know, we're all frustrated by what's going on, but we just got to keep going. That's about all I got.
All right, thanks, Gary. I don't see anybody from the school on, but I am, so I guess in the same kind of vein, Rotary got 2,000 paper masks, and then I still had a bunch of cloth masks from the state when they were giving them to nonprofits. We're gonna end up giving all those to the school because I guess the schools are in between kind of waiting for masks from the state. So I won't have a store anymore. I know most of you knew that I had a box just waiting for like the blow up. I did save some packages of cloth masks, and Gary has some, but just so you know.
The Department of Health did have a bunch that they were trying to get rid of. I don't know if you
Okay.
have connected with them, but I know we've been
Okay.
getting some for the Randolph area.
Oh, good. Okay.
So Rudy Fedrizzi, I don't know if you are connected to him, but I
No.
can send an email to both of you and see if they
Okay.
still have some.
That'd be awesome. Thank you. Yeah, it seems like all the schools are low. So.
Yeah, I still have them stored at the BA, and we've given them out in the town office.
Cool.
I thought if things really got bad, I might make an announcement and have a time that I would be giving them out someplace in the village, but
Yep.
I'm trying to keep them until there's
Yeah.
a dire need.
Totally. Cool. Thanks, Gary. I don't think anything on communications, and then volunteer coordination. Pastor Amy did get back to me last night with she has divided all of the 60 plus population, and is handing those out to volunteers that had said they were willing to make phone calls with a script and stuff like that. So we'll be doing that shortly. Ryan, town local stuff.
I don't think there's anything pressing going on in town. Nothing that I've heard of, unless Ted has anything. He's shaking his head. No,
nothing.
Okay.
Nothing. No big updates.
Okay. And I don't see Sarah on. Let me just ask, just so I don't skip over it. Who is called in with 299-7838?
That's me, Monique. It's Patty.
Okay, cool. Okay, just want to make sure.
That's
Let
okay.
me just rename you. Just don't want to skip anybody.
Okay.
Food access, Aisleen.
Yeah, so there's a couple of updates. The Topsom East Corinth food shelf is no longer accepting everyone eats frozen meals. They feel that I believe they're staying open, but they are not doing that anymore. And so Jacqueline LeBate, who represents the Growing Peace Project, she is still receiving she's still receiving produce from Willing Hands and meals for the Everyone Eats program. But now we believe 40 of those frozen meals will be going to the Bradford food shelf and 40 will be going to the Teen Hub. And then this Friday is the last Friday for food pickup at the Newberry, now I'm forgetting. It's the Newberry Library, I believe.
Okay.
They usually have an outdoor food pickup on Fridays. And this is the last week for that. They're trying to figure out how they're going to move forward, but they don't know yet. And that's all, I think.
Cool. Thank you. Actually,
Sorry. One last thing was that we are doing a big push at Little Rivers to encourage people to use the Bradford Community Food Shelf or the Bradford Food Shelf, because they are actually throwing food away because it's unutilized, but we are seeing high numbers of food insecurity. So I don't believe there are any restrictions right now in accessing that space. So even if you know of people who need food and you can stop by and pick up food, we're really encouraging people to make that connection, because our problem or our challenge is getting food to people who seem to be in need.
Cool. Two things on that. One, do you need help with advertising the 40 meals at the food shelf and the hub, or do you think they're more or less spoken for? Like,
let me follow up with you about that, because I'm not sure what their capacity is. Like, of course, we want those meals to be used, but maybe they already have a sense of they're gonna go. I know Little Rivers, we're not advertising right now because we are at capacity, but let me follow up about that, because that would be good.
I think during our last meeting was when I brought up the idea of doing the that I wanted to do like a little video of the food shelf. So I did go and interview Jenny and Pam Bean, and I'm working with Danielle. It's going to be a no budget video on my iPhone, but yeah, I think it'll, I don't know, it just went over like how to use it, how to tell somebody that it's there, what the restrictions are, what kind of food you can expect. So I'm just kind of working on that in the next couple weeks. And Ramsey and Linda, actually, I was probably gonna reach out to you two, Ramsey or Linda. I don't know if you would be up for like doing a Zoom interview on. I'm just gonna make it all inclusive with like some of the like applying for fuel assistance and kind of the other programs that people might not know that they're you know, they qualify for.
Sure, I'm willing.
Okay, cool. And just like be super low key with Jenny. It was just like asking how to use it and stuff like that. So
All right.
cool. Let's see. Medical, Ayla.
Hey, thanks. I love that idea about the food shelf. I didn't know you were doing that, Mike. That's great. I think people
Let's
really
see.
need to see that video. So good work. A couple of things. No dramatic changes. I think we're all pretty aware, and Gary spoke to the travel restrictions going over the border to New Hampshire. As of right now, the recommendation certainly is, you know, just for essential workers, or if you're traveling home. So that's been something in the Bradford community we're really trying to share. It's shocking how many people are unaware of not only the travel restrictions, but what's going on in New Hampshire right now. So really just getting that word out and asking, you know, if they are aware. And of course, talking to patients and community members about the holidays and remaining vigilant. I thought a good point that Dr. Levine brought up, though, too, was also, you know, in that conversation, also could, you know, so congratulating is not the right word, but recognizing when people are following restrictions and validating how difficult that is, especially during the holidays and especially for the elderly, and that, you know, that we just have to continue to be vigilant, and what they're doing has helped prevent further cases. So I think just sometimes bringing up that positive, the positive thoughts about that as well. But as far as we're, you know, really supporting the flu vaccine, obviously, this year, and I've done numerous clinics and really encouraging people to come get their flu vaccine or go to the local pharmacies that are offering it, help reduce the spread of illness. And then the other thing on our forefront is certainly considering mental health. As cases are continuing to climb, we're expecting a second wave during this fall seasonal period, and with that, of course, increased restrictions. The holidays are coming up. We know that a lot of us deal with seasonal depression out there, and so just being mindful of that, mental health needs will probably be increased during this time too, and certainly we'll see some of those needs popping up. I think that's pretty much it as far as from a medical, unless Ashley, you have anything to add from the COVID team. No. Okay.
No, I don't think so.
Okay.
I think you covered it all.
Okay. Thanks.
Cool. Thank you. Business and financial, Patty?
Nothing really nothing new. Still working on the loan forgiveness process and that. It's business as usual at the bank. Come in and happy to see you and happy to see your mask.
Cool. The Agency of Commerce and Community Development's like 2.0 recovery grants is open. They expected it to run out, well, not run out, but like basically it's first come first serve. So they expected a drain on it probably by the end of this week. I don't know if that's still the case. That was the kind of the forecast at the beginning. So like in my job, I know we've been helping a lot of people just through their financial paperwork and stuff and applying for that. As far as I know, the Restart Vermont's program for technical assistance still has money. I haven't seen it close down yet. And trying to think if there's anything else. Yeah.
I just learned today from Two Rivers that there will be another round of the sole proprietorship grants,
Oh,
which unfortunately is a lottery system, but still it's worth applying. And they think it will be announced in January.
Huh. Okay. Cool. Thanks, Nancy. That's good to good to know. I can't think of anything else. And
Sorry,
seniors?
Nancy, that
Oh,
was
go
called
ahead.
a sole proprietor grant?
Yep.
Okay, from Two Rivers.
It's probably through ACCD still.
Well, Ashley, do you want to be put on their mailing list or their email list to be noted?
No, not right now. I just wanted to make sure I got it right in the minutes.
Okay.
But thank you.
Well, if anybody does want to be put on their email list, they can let me know with their email and I'll forward it. Thanks.
Nancy, are you talking about Two Rivers or ACCD?
I'm talking about the sole proprietorship
Okay.
grant that's being managed by Two Rivers.
Okay. Seniors, Carol.
Well, the timing is a little off. We are reopening the senior center to activities, and part of it is for the mental health needs. And because the square footage requirement is now 100 square feet per individual, so we can open for groups of up to 20.
Yep.
We're going to restart our senior exercise program with very strict protocols in place. They are in place. So I think that's good news for the senior community. We have seen an uptick in the number of takeout meals that people are coming for. I think the word is finally getting out. And if you can help get that word out, there are takeout meals available Mondays and Wednesdays, and you can get a full week's worth of meals. The other thing is we are anticipating that the demand for Meals on Wheels will go up as the numbers of cases increase and as the weather changes and people aren't out and about as much. So that's sort of the senior center side of it. It also, I think, either last week or this week, they're starting to allow some indoor visitation at Margaret Pratt for family members.
Oh, wow.
Very restricted in terms of following strict protocols, but people are able to be in the dining room to see family members.
That's great. I was kind of sad to see all the groups that have been using the space go back to the senior center. But I'm happy for them. Cool. Marianne, did you have anything you wanted to add?
No, I don't think so. Pretty much status quo here. Still plugging away, doing a few home visits. It feels a little awkward giving the trend right now. So I'm not feeling like really, it's again, not maybe the best timing, but we're continuing to plunge forward step by step.
Cool, thanks, Marianne. And I did share your, I think it was last week, or the last meeting. I did share it on Facebook. I don't know if it ever comes to anything, but it's been going out.
Wonderful, thank you.
Yeah, totally. Schools, I don't see anybody on. Nancy, did you have anything for mentoring? Okay, and I guess school updates, there's a board meeting tomorrow night. And then there's an informational Zoom stream thing on Monday about the budget, and then the budget vote is on the 24th. So those ballots have not gone out yet, just to lessen confusion with the existing election, but that should go out, I'm guessing, probably next week or something. And Brian, did you have anything for like youth sports at all?
There's a meeting tonight at the Colatina because we can't find space anywhere else.
Oh no.
So we'll be meeting there. We put out registrations for basketball, but we still haven't gotten any guidance in terms of what we're going to be able to do. But again, without gym space, it's going to be awfully hard to have a season. So I think they're just collecting that, and it's kind of that hope that maybe something breaks and we're able to at least do clinics. I don't know what it'll look like, and I think it'll hinge on what the middle school and high school level are going to be able to do as well. So
okay, cool. I don't see Gail. Churches, I don't see Carol. Housing, Ramsey or Linda?
Not a whole lot of changes as far as housing goes. There's still some money they're trying to get out for back rent and things like that through the CARES Act, and applications for those programs are going to be, the end date is December 11th for people to apply. They also, legal aid has opened up a program for mediation right now, for landlord tenant mediation. That is kind of a, I don't know, I think it's a short period of time, but something that they're hoping that they can maybe alleviate some issues between landlords and tenants before it comes down to the money being gone and the more eviction moratoriums going away. So so that's good. I did talk to Marcy yesterday, and she has an apartment available, and so there's some things opening up a little bit, but it's still fairly similar. A lot of the there are some housing projects like in Windsor County. There were the Wyndham Windsor Housing Trust got some money, or helped landlords access the money that they could use for rehabbing. So there should be about 30 units coming online in the Wyndham Windsor area. I'm not sure if, I haven't heard that many landlords in our service area were able to take advantage of that program either. I haven't heard details about that. But there's a couple things open if we can find people who can actually afford to get into them. Otherwise, there's going to be a lot of people still in hotels this winter as the weather starts getting colder. I think that's all I have, unless anybody has questions. Our conversation we had last time a little bit about whether there would be any kind of funding, which would also be ACCD funding for doing something like doing something with outdoor options for kids for sporting things in the winter or things like that. I talked to somebody about that, and he was going to look into some demographic information and find out if the grants that he was thinking of would be accessible. I guess the money that he's thinking of that would be available has to be shown to be serving a certain income level. So if it depends on the percentages, and he wasn't sure where Bradford would fall on that, but he was going to look into that for me and let me know. And once I know something about that, I would send it along. It is funding that the town would have to apply for, and then whoever the group that is going to be would be the sub-grantee. And what he told me was the best things to do and the best things for that towns like to see, and probably people who are on the select board maybe would agree with this, is that if people would need to be approaching them with a plan in place, not just, we have the option to have some money, let's think of something to do with it. Like if you want the town to apply for something, you need to have a plan in place, who's going to be managing it, and all of that information. But I had just been talking to him because we had sort of been talking about, like skating rinks and putting up a permanent tent over, or a semi-permanent tent over something for the winter to have more space for people to be able to do something. And a couple different people in the same period of time had talked to me about different ideas about that kind of thing. So in another meeting that I'm involved in Randolph, I mentioned some of those things, and this person who's on the board with me works for the state and is involved with a lot of that funding, and he said, there is money for this kind of thing. So anyway, I just wanted you guys to know that I'm trying to get a little bit more details, and then I can let you know.
Cool, thanks, Ramsey. Linda, did you have anything you wanted to add?
Not really, other than just a reminder that Crisis Field will open the Monday after Thanksgiving, so the 30th. And right now we have very limited pots of money. So we may not be able to help much, but we can help with the supplemental fuel application. So people should be trying to get that in, because that will hold up our ability to help when money does come in if people are eligible and they didn't apply.
Okay, thank you. And then just a reminder that the housing forum is next, nope, the 13th, Friday the 13th, 10 a.m. I'll put a link in the chat if you haven't registered. And it'll be streamed and recorded so you can watch it later. But
Monique, is there content that you specifically know you're going to want us to have? Is that?
Yeah, I'm definitely sorry. I'll definitely have that out
That's okay.
by this week.
Okay.
It's so I did meet with like Dale Bromley this week because he had, or last week because he had the same questions. But really just I think stuff that you'll already know, like the trends you're seeing, the demographics you're seeing, the kind of the numbers of people who need help, the type of housing that we should think about. Maybe if you have ideas of other towns that have really worked on housing and are good examples of you know, similar cases that we could look at. And then like I'll probably give time to like Two Rivers and Buttle Communities, since they have like and you guys, since all of you will have like statistics and reports that we can actually reference for more information. I think it's going to be hard to like squeeze it all into an hour and a half, but I feel like if there's content that comes out that makes sense to like have a follow-up with, like maybe just like one thing focused on you and one thing focused on like the communities report or something, then that we could totally do that.
Yeah, even
so,
if there's a
yeah.
parking lot kind of idea where
Totally.
the questions are coming up, then we can always get the answers if people have questions.
Exactly. Yep. I'm imagining a part 2 to the the thing for sure. But I will send you more ideas in writing. Nothing from transportation that I know of. So I guess just thinking about the timing, it'd actually be awesome for me if I have this like, I'm on this like statewide youth advisory council that's been meeting on the third Wednesdays, and I would love to attend it. So I don't know if people would be open to, Linda was asking about setting like set dates. I don't know what people think about like doing the 2nd and 4th. We could skip next week and just do the 4th this month, but does anybody have conflicts if we did 2nd and 4th Wednesdays rather than every other? Okay, cool. That would be awesome. So we will skip the next one. So the next meeting would be day before Thanksgiving. I understand if not everybody can make it, but hopefully not everybody's traveling. And yeah, so 11:25. Is there anything else anybody had or questions for each other?
I have a quick thing, and I'm embarrassed that I don't know this, but somebody called me, I want to say last week, and said they did have travel plans for Thanksgiving, and they wanted to know when they get back, what's the protocol for being tested? Do they need to have an appointment? Where's the nearest testing site? And I should know this, but I don't. So I told them to call Little Rivers. But just for my own edification, what is the protocol these days for getting tested?
So typically, Ted, we have them as soon as they come back, tested within 48 to 72 hours. And then we recommend a retest within a week after that while still quarantining. So just because it depends on their length of travel and that sort of thing, but the incubation period can be anywhere from 5 to 14 days. So before a test will become positive. So really, yeah, it's pretty individually based, but they can certainly call and chat it out with our triage nurses. We would recommend them obviously quarantining for 14 days until at least typically 2 negative results. And then they can get tested here at any of the Little Rivers clinics just about any day. And certainly there's the public clinics that are most local, I believe, are still Rite Aid up in Woodsville, and Cottage Hospital is doing some intermittently. Ashley, do you have any updated information on the Cottage Hospital testing?
I don't have information on the Cottage Hospital testing, and I don't believe Rite Aid will test anyone under 18.
Yeah.
Not sure if that's
That had been, yeah, I had heard that, and I thought we had clarified with them that they would do that, would test under 18, but perhaps that's changed again.
Yeah, I'm not sure. I guess Little
But,
Rivers will
yeah.
test for under 18.
So
Okay.
Little Rivers Bradford is testing now too.
So yes, we have been testing all along. We try to group people together in the afternoons, and patients that really can't make it to the Wells River Clinic. What's ideal about the Wells River Clinic is we do it Monday, Wednesday, Fridays in the late afternoon, and it's kind of a drive-through setup. So they can go in, get swabbed, and go out. So they can see many, many, many more patients than we can having them come into the parking lot or go, into the clinic. So yeah, it depends on the situation, but we certainly do test here every day.
But also
Does
people
that-
have to be Little Rivers patients at Little Rivers.
Yeah. Ted, does that help answer a
Well,
little bit?
It does, and it sounds like even though I was sort of winging it, I said the right thing by saying call Little Rivers. It sounds like there's enough variables that you really need to call and give all the specifics. So
yeah, it is. Yeah, and it boils down to too, are they symptomatic, and all kinds of things, and we'll definitely want to see them as opposed to just swabbing them. So there are a lot of factors, and I'm sure it'll change.
And
it'll
I want to
continue.
say too that there's drive-through COVID testing down in White River Junction at the Vermont Department of Health every Thursday.
Oh, that's good to know.
But you can go to the Vermont Department of Health website and find out the schedule, because there's also testing in St. Johnsbury, Randolph, and White River.
Yeah, great. Thanks, Ashley.
Hey, thank you.
Anybody else? Okay, cool. And then for the few people, the voting members, I am behind on, I don't have the minutes from last week and I didn't send those out, so we'll just do them at the next meeting. So thank you, everyone.
Okay,
See
thank
you on the
you.
25th.
Okay.
Bye.